just go ahead and speak right away about the three positions. The Federal Ministry of Health is delighted to be at this public hearing for the establishment of the Blood Service Commission, which will vastly boost the quality of blood services provided across the nation and lead to a significant improvement in health outcomes. There are significant variations in the availability, quality, and safety and use of blood and blood components provided in both private and public health establishments at the moment, exposing citizens to risk of infection with transfusion transmissible diseases such as HIV, hepatitis, and syphilis. The Federal Executive Council had, in a memo in 2017 and 18, endorsed the establishment of the National Blood Service Transfusion as a commission to help address some of these variations. Barriers to a well-functioning national blood service include inadequate regulatory framework and resource limitations. The establishment of a National Blood Service Commission is something we have looked forward to because it will effectively address these barriers. There is also need to address the variability of quality and service which is required for a national blood service, and we need one that is empowered with the requisite legislation to safeguard blood transfusion value chain across health facilities, from point of collection to storage, screening, transportation, and finally blood transfusion in adherence to establish global and national guidelines. That under the current structure of the blood transfusion service, the quality of blood service provided across the country cannot be safeguarded because there is no existing legislation in Nigeria to coordinate, regulate, and ensure safe blood transfusion practice for the country by affecting compliance of health facilities to national guidelines. For a country of our size, and for our also regional and global importance, the present state of affairs regarding blood transfusion in the nation is undesirable. Honorable Chairman and members, the issue agree that that the clear framework is critical to ensuring protection of lives, health, and well-being of citizens. The current lack of legal backing for NBTS role of ensuring blood safety in the country severely hinders its ability to perform these roles effectively. This has affected implementation of the National Health Plan and impeded achievement of sustainable development goals and universal health coverage. The establishment of a National Blood Service Commission therefore has several clear merits. First, the management of medical emergencies requires that adequate supplies of screened blood and blood products are available in national and regional blood banks at all times. Secondly, blood safety regulation will guarantee dedicated funding from federal government for the operations of the blood service and facilitate opportunities for robust multilateral partnership. Thirdly, the proposed bill, when passed into law, will establish a commission that will coordinate blood transfusion practices on a countrywide basis within the National Health Plan and act as the sole regulatory and accrediting authority for blood services nationwide, thereby protecting Nigerians from risk of transfusion with unsafe blood. Finally, it will also enable creation of a national blood service that could be activated when there's a national disaster as occurred during the 2014 bomb blast. Recommendations from the World Health Organization state that a national blood service should be funded from national budget. Consequently, funding will be required from the federal government's annual appropriation for the takeoff of the commission and for subsequent operation on an annual basis. The Blood Service Commission will be able to generate significant financial returns for government through the production and sale of a suitable range of therapeutic blood products by blood fractionation and such as plasma and plasma derivatives of medical products locally, regionally, and internationally. This means that it's possible to export the blood derivatives when it is put in place. This will not only create jobs and yield additional income, it will also reduce the pressure on national budget by generating revenue. In conclusion, the Federal Ministry of Health reiterates its support for any progressive initiative that improves health outcomes and benefits health and well-being of Nigerians. The National Blood Service Commission Bill is therefore endorsed by the Federal Ministry of Health because of its overarching goal of protecting the health of Nigerians and providing an enabling environment for an enhanced access to quality healthcare services that are available and affordable to all Nigerians, which is being amended. We support today's event because it contributes towards strengthening the roles and responsibilities of the National Primary Healthcare Development Agency to provide technical and programmatic support to the states and local governments on the development of primary health care in Nigeria, which will ultimately improve overall health outcomes in the country and accelerate our journey towards universal health coverage, which, as we know, is a cornerstone of the President's agenda. We appreciate the support of all honorable members here in this House and the chairman and members of the committee and the National Assembly and their support and oversight towards improvement of primary health care in Nigeria. We also recognize that significant changes have occurred within the national and global primary healthcare landscape in the past few decades, including continual changes in the fiscal space, innovative technology, health security, the nature of infections and emerging diseases, and the basic demographics of Nigeria's population. The transformation has expanded the role and responsibility of public health agencies globally beyond direct service delivery to program management, quality control and standards, and performance monitoring and enforcement, which have added new layers of complexity to primary health care and national immunization systems that must be examined through the lens of coverage rates, service delivery patterns, and improvement in the standard of living of our people, which is the ultimate goal of the Ministry of Health. NPHCDA has encountered some challenges and operational limitations in discharging its mandates as an agency. The Federal Ministry of Health is undaunted in our collective vision to make primary health care services available to all Nigerians as the cornerstone of the administration of President Muhammadu Buhari. Our journey to a rebranded, transparent, professional, and effective agency has been characterized by many successes, and it is significant to note that Nigeria has been declared wild polio virus free and will, in a ceremony, be certified free of wild polio virus by the World Health Organization in August of 2020. The achievement of polio-free status is a hard-won battle spanning over 3 decades of hard work and dedication of the polio team, partners and donors through years of the defunct National Program on Immunization to the National Primary Healthcare Development Agency established by an act of 1992. We salute all those Nigerians who participated in this struggle. However, from the technical point of view, the transfer of the functions of the NPI to the agency with regard to polio eradication initiative and routine immunization was not completely captured in the current act. The amendment of the current act will provide an opportunity to highlight and strengthen our mandate to serve Nigerians better and ensure that basic healthcare services are equitable, people-oriented, and delivered in accordance with established quality standards and protocols. Some of the amendments and additions include the following. In Part 3, 4B, we have now incorporated the establishment of technical support programs. 4J, we have better captured our role to promote accountability for primary healthcare systems through periodic performance review of the activities of the state primary healthcare boards. 4N, we have fundamentally incorporated the core responsibilities of the defunct NPI into the functions of the National Primary Healthcare Development Agency, that is to plan, to procure, to administer, and recommend appropriate vaccines into the National Immunization Schedule. Part 5, for the purpose of effectively discharging its functions and mandates, the amended Act has incorporated a decentralized approach in accordance with geopolitical representations. The establishment of the State Primary Healthcare Board in 36 states and Federal Capital Territory, thereby improving the roles of the provision of technical and programmatic support to states and local governments. Part 6. The agency, subject to the provision of the National Health Act, shall periodically review primary healthcare standards in the states and the implementation frameworks and protocols by states and local governments where applicable. The Federal Ministry of Health therefore supports the move by this Honorable House to amend the NPHCDA Act in line with the current realities and the needs of the agency and of Nigeria. Working with our development partners, donors, civil society organizations, we shall continue to keep our promise of changing the face of primary healthcare delivery in the country, which is the foundation of all healthcare delivery. Coded, classified, in order to produce statistics on the occurrence of cancer in a defined population in a specific time period, and to provide a framework for assessing and controlling the impact of cancer in the community. The Federal Ministry of Health established the national headquarters of cancer registries in Nigeria in the 1990s to coordinate cancer registration and the activities of cancer registries in Nigeria. This was domiciled at that time at the Department of Surgery, University College Hospital, Ibadan, under the pioneer chairmanship of Professor Sholanke, and the National NHRCN, despite several challenges due to inadequate funding, recorded successes. It later metamorphosed to the National System of Cancer Registries, NSCR, in 2009, with expansion to other institutions that have the capacity to diagnose and treat cancers in Nigeria. The activities of NSCR are largely funded by the training grants from the Fogarty International and the Federal Ministry of Health. The NSCR, which is currently being directed by Professor Clement Adebamowo, who was trained by Professor Sholanke, engages in establishing new cancer registries, strengthening existing registries, providing training and mentoring for cancer registries, and monitoring the data generated for completeness and accuracy. The NSCR is under the control and supervision of the National Cancer Control Program, Federal Ministry of Health. It carries out regular site monitoring visits and provides technical and scientific support to cancer registries in Nigeria. Presently, there are 33 cancer registries in Nigeria, comprising of 13 population-based cancer registries and 20 hospital-based cancer registries. And these cancer registries are independent units under a director in tertiary hospitals, which has the capacity for diagnosis and treatment of cancers. It is worthy of mention that tertiary hospitals are established by law to provide healthcare services, training, and research. Cancer registries are integral units of the tertiary hospitals, and the cancer registries are coordinated by directors with other support staff, cancer registrars who are employees of the hospital. Data from the cancer registries are collated, analyzed, and used for evidence-based policy formulation and implementation by the National Cancer Control Program at the Federal Ministry of Health. The bill for an act to establish a cancer registry and make provision for compilation of statistics record to the incidence of cancer to provide a basis for direction of program for research and cancer treatment for related matters. We note that the purpose of the proposed registry are to provide information on the incidence of and mortality from cancer, to provide a basis for cancer survivor studies and research programs. The reasons for establishing the proposed cancer registry as above are already effectively addressed by the establishment of the cancer registries in the national tertiary hospitals where cancer care is provided. Data from these hospitals are analyzed by the NSCR, which informs policies and programs of the National Cancer Control Program at the Federal Ministry of Health. It will therefore bring an unnecessary conflict between the tertiary hospitals and the proposed cancer registry that will become an independent entity with similar mandate and enabling acts. It is also important to note that His Excellency the President recently signed into law an act to establish a National Institute for Cancer Research and Treatment of Cancer Patients in Nigeria and related matters. That is the Act of 2017. The Institute is still yet to take off by this Act, but it shall provide national leadership in cancer research, control, and treatment, and guide scientific improvements to cancer prevention, treatment, and care. The Nigerian Institute for Medical Research, based in Yaba, also has a similar mandate by its enabling act. Therefore, the establishment of another agency of government to provide cancer registration shall be tantamount to duplication of duties and worsening the unhealthy conflicts in the health sector. This will also lead to unnecessary waste of government resources. Tertiary hospitals are established by law to provide healthcare services, training, and research. Cancer registrars are integral units of tertiary hospitals. Presently, as we have stated, there are 33 cancer registries in Nigeria located in tertiary hospitals across the country. Other agencies, such as the Nigerian Institute of Medical Research and the new Cancer Institute for Cancer Research, the new National Institute for Cancer Research, were also created by law with similar mandates to conduct research, utilize their data in cancer care, and inform policy making by government. To establish another agency again, just to collect data from the health institutions, is unnecessary. It will be more appropriate to make adequate budgetary provision for cancer registry strengthening to improve the efficiency and capacity of the existing national system of cancer registries. In view of the above, Mr. Chairman and honorable members here present, we wish to recommend that the bill for an act to establish cancer registry to make provision for compilation of statistics, record to the incidence of cancer, to provide a basis for direction of program for research and for cancer treatment and for related matters is not necessary. It is a duplication. Therefore, there is need, instead of that, to increase budgetary provision to support and strengthen existing cancer registries in Nigeria, which are currently doing very well and working to our full satisfaction and serving the purpose which we all want to see.
To hear some of the cogent reasons why I sponsored this bill, that's the bill for the establishment of the National Blood Service Commission. I want to share an experience that inspired me to take this noble direction. My daughter, who is now 28 years old, and who incidentally is a sickler, occasionally, whenever she had crisis, require blood for her to actually be revived. And about 10 years ago, in such kind of crisis, she was administered with blood that was infected. And the resultant effect is that she has a hepatitis B that she has been living with to this date. It was much later, after she tested positive to hepatitis B, that I came to realize that the cause of that was a bad blood that was transmitted to her while she was on a hospital admission. And that is the reason why I said, this story that my daughter is facing, which I believe is a story that so many other Nigerians, thousands and thousands of Nigerians are facing, should be taken up strongly. Because unless we take the issue of blood transfusion seriously, more and more people will suffer and more people will die. I was privy to the statistics of the blood transfusion administration in Nigeria, and I was amazed and sad to find out that Nigeria, being the giant of Africa, is incidentally one of the most backward when it comes to the issue of blood transfusion and administration in Africa, not to talk about the world. So the statistics is very gloomy from all aspects that you look at, from accident-prevented fatalities, which from time to time require blood on emergency basis. A lot of people die because blood is often not available to assist those patients. Likewise, on the issue of maternal mortality, that is one area that Nigeria is even ranked almost number 150 something in the world, because more and more women die because of blood loss during child delivery, and because the blood wasn't available to actually assist them to get better. Again, we realize again that safe blood is another critical area that this country has not been able to do much about. Honorable Minister has just mentioned it, and I have just given an example of my own daughter, who is a living victim of such. We believe that with the establishment of a commission that will serve as a regulatory agency, such kind of avoidable deaths, avoidable sufferings, and improved service delivery will be attained by Nigeria, and that's the reason why I feel obliged to sponsor this bill, so that Nigeria and Nigerians will have a better life.
So many lost their lives through unnecessary reactions. Many are incapacitated through transfusion without following the required guidelines. So we do hope this bill, when passed into law, will address all those challenges. Honorable members, we have had contribution from the Honorable Minister. If there is any area you think you will address this. Honorable Minister, I would just say that on our own part, the Secretariat received memorandum from the MDAs, that's the National Primary Healthcare Development Agency and National Blood Transfusion Service Commission, that we are about to pass.
Go to see to providing safe blood, because there are critical pathogens that have to be excluded in safe transmission.
What I'm saying, the ministry did not submit a position. What came from National Primary Health Care is also the input of ministry is taken care of. Yes, it's all right.
For this fantastic bill that he has sponsored, mine is just to give an experience in line with what he has just said. As a medical student, I remember a lady who had DIC, and she was transfused 16 pints of blood before she survived. So if not for an efficient service, she would have lost her life. And as a physician, I've treated no less than 3 women that got HIV because of transfusion. They are still alive, thank goodness for good drugs, but they are all avoidable things. So, Honorable, we want to once more thank you for this sponsorship. We are all behind you. Thank you.
Steam pie, which in normal standard world practice is a waste of blood. We all agree. She survived, but it's a waste of blood. All she needed is a few components of that blood. The platelets of that blood, or the fibrinogen, that will be given to her so that she can survive without being overloaded. So we can now see the bill will ensure that blood product is available.
Action Nation, which can produce plasma and immunoglobulins and the various other blood components, like platelets as you just mentioned, not only for local use, but which is on hot demand for export. So if you have the necessary commercialization processes, working with partners, we are in a position to be able to go into commercial blood fractionation.
Of what the bill entails. Definitely it's about industrialization of the health sector of the country. Apart from saving lives, it's also sustainable, creating a value chain around blood and blood products and creating jobs for Nigerians. We really have very serious problems concerning primary health care or health administration, particularly in maternal health. We lose around 50,000 women every year to preventable maternal death, and 20% of that is from obstetric hemorrhage, that is loss of blood during child delivery. If you spread it out for the year, it's around 130 women dying every day from preventable causes, and 20% of that, around 25 women will lose from severe obstetric hemorrhage, that is bleeding or loss of blood during childbirth. And this bill is trying to work together to create an institution that will really take care of that and prevent those unnecessary or preventable deaths. Secondly, about road traffic accidents, another pandemic that we have in this country, with an average statistics that every 6 minutes an accident happens in this country, and somehow, in some cases, a life is lost. Most of the times also due to hemorrhage. I think road traffic accidents are a public health emergency or a disaster also, which a lot of the deaths come from lack of blood or blood products. So once again, I only want to thank this committee and the sponsor of the bill and the Ministry of Health for concurring on this all-important institution that we want to bring up to save Nigerian lives and also create jobs in the end through health industrialization. This is typically health nationalism post-COVID-19.
I just want to say something on the third one, that is the bill for the establishment of a cancer registry. Just nothing different as such, but to add something to what we already presented, which has to do with, the position of the ministry is that we don't really need that bill. But it's important to call the attention of your honorable selves to associated issues. Every bill has financial implications, particularly when it comes to